Good morning, everybody.
Good morning.
I'm Susmita Kashikarzal. I'm a professor of pediatrics at Cincinnati Children's Hospital, where I have been since '99, and actually moved here to Cincinnati to set up the Pediatric Chronic Pain Clinic, which is a multidisciplinary clinic at Children's. Started off primarily as a clinician and then have been doing much more research in the area. So with my background being in pain and treatment of pain, and for the last couple of decades focusing primarily on the treatment of pain in children and teenagers, I may have some examples and things that are maybe a little bit younger, but I think sometimes those are easier to understand. So the topic today is the psychobiology of pain and reasons that people seek holistic care for pain. So just in terms of background, we always do this at our presentations. I have no financial conflict or other conflict of interest to report based on any of the treatments or anything I'll be talking about today. The funding for my own research comes from the National Institutes of Health and from the Childhood Arthritis and Rheumatology Research Alliance, as well as the Cincinnati Children's Research Foundation. I was formerly a member of the Advisory Council for the National Center for Complementary and Integrated Health at NCCIH. So that's just to let you know where I'm coming from. So today I'd like to cover a couple of different things. So first I'll just talk about what is pain and what are the different types of pain. Then we'll talk about the impact of pain on people's lives, and then I will dive a little bit more into the biology and the psychobiology of pain. So how do we feel pain? And then go on to why people seek out mind-body interventions for pain and what we learn about those. And what should we expect? What realistic expectations should we have from mind-body approaches for pain management? All right. So there is such a thing, there is a definition of pain, right? And pain is defined as an unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. And this has been put forward by the International Association for the Study of Pain, which is our large international research organization. And what is key here is that pain is by definition a subjective experience. It is something that you experience. It is difficult to measure. If any of you have been to a hospital or you've had some surgery, and oftentimes a nurse or somebody will come to you and say, what's your pain on a 0 to 10 scale? That's really hard to say because it is a subjective experience, and based on your own history of prior pain experiences or whether this is the first time you've experienced pain like this, that 0 to 10 scale sounds a little bit, that it could change. But really, pain is something you cannot see through an X-ray. It is not something that, some type of radiology test or something. They can tell you about inflammation, they can tell you about disease activity, but they cannot tell you, nobody can tell you how much pain you actually experience because it is subjective. So, a lot of times people see pain as a really bad thing, right? Pain is horrible, it's unpleasant, and it is. But pain is an important part of the human experience because it is a warning signal. It means something is not quite right. And it can happen for many different reasons. But what it does is, for the most part, it helps us to avoid injury and to stay safe. There is a rare genetic disorder in which some children are born without the ability to feel pain. They do not last very long because they do not know when they're going to hurt themselves. So a lot of them have very injury-prone behaviors, and they end up with diseases or other things, and they cannot report it because they are not experiencing the pain. So we really cannot do away with pain and say, go away, because it does play a role. Now, what I'm going to try to do is try to explain to you a little bit about when pain can be a good warning signal and when pain is an indication that, it's kind of like a useless fire alarm that just keeps going off and nothing's really going on, because that can happen too. It is a little bit complicated. So I thought it would be good to explain to you what the different types of pain are. Okay? So you can have acute pain. Acute pain is defined by something that is time limited. So you know pretty much it's going to go away. It can resolve in a few minutes, like when you bump your toe somewhere and go, ouch, that hurts. You know that's going to go away for the most part. Or you might have inflammation from something, or you might have an injury, but you know that within a few hours, days, it is going to go away when it heals. Chronic pain is a little bit different. That tends to last several months, if not years, and it is defined. So the minimum amount of time something has to be present to be called chronic pain is about 3 to 6 months. But if it lasts longer than that, that is usually longer than what it takes for normal healing processes to happen. And it can be related to different things. It can be related to a disease that you might have. So you might have arthritis, for example, or you may have some other type of medical condition that is related to having pain. Or pain can be a pain condition in and of itself. It can be the disease itself. So for example, some diseases like fibromyalgia or migraine, that is the condition, okay? And oftentimes there is no identifiable cause, which is not to say there isn't a cause, it is just not identifiable because we haven't got to the point where we can just take an x-ray of it or take a blood test. It's like, oh yeah, of course, you have this. It's based on self-report. When you go to a neurologist with a migraine, it's based on this. They might do some testing, you might have an MRI, we just want to make sure you don't have a tumor, that you don't have some other structural problem with your brain. So they're doing that to sort of rule out other things. But really, the headache is the headache that you experience. No one can see that headache. Nobody can necessarily see that back pain. They may see some things that may cause it, but really the pain is the condition itself. Now, to make life a little bit more complicated, there's even other kinds of pain within chronic pain. So you can have musculoskeletal pain, that is pain in the joints or in the muscles. It can be more internal, it could be visceral pain, so belly pain, for example. It can be neuropathic pain. Pain is, nerve type of pain. And those are actually sort of working in slightly different ways. But all this to say is that there are a whole variety of different types of pain that can happen. And what we know now is that chronic pain is a very, very common problem. You may have heard this in other talks today, is that over 25 million adults in the US suffer from pain nearly every day for the past 3 months. You wouldn't think it's that common, but it is. And some other figures show that people have experienced severe chronic pain or severe pain. Now, what we know is that chronic pain can result in a lot of changes to your daily lives, just in terms of what you're able to do, your physical activities, needing to see the physicians a little bit more often, and sometimes flat out being really on a daily basis feeling very disabled by pain. So reduced ability to work, go out with friends, do social activities, and sometimes a dependence on pain medications. And pain just overall can affect relationships and your interactions with people all around. So having chronic pain is not trivial. It can have a lot of impact. Now, really the big question oftentimes is what happens if pain persists? So when pain is related to an injury, when it's related to a disease, when it has a very clear cause, the medical system is usually pretty good at coming up with treatments for disease, treatments for very specific injuries, orthopedic injuries, and things like that. But what if they get the disease under control, but people still have pain? What if there is no very clear reason where this pain is coming from? So that is the puzzle of pain, is how can this happen? Well, we know from research that pain can persist even when there doesn't seem to be an obvious injury or a source of pain. So for example, in fibromyalgia, which is a condition that I do a lot of research on in children, but it happens a lot more in adults, people can suffer from diffuse muscle and joint pain even without underlying inflammation, because a lot of times patients will come to our rheumatology clinic because they think that their child has juvenile arthritis or some type of inflammation, and then they do all the tests and there's like, no, the joint's not inflamed, so it's not arthritis, and they do blood tests, it's not related to other things, but it can occur by itself. Now the unfortunate part is when there is no obvious signs of disease or injury, some people may think that the pain is in your head or it's psychological. And sometimes even medical care providers can intentionally or unintentionally give that message that, hey, maybe you ought to go get your head examined because we really don't know where this pain is coming from. And so I spend a lot of my time teaching and training medical personnel as well to really understand that pain is a larger thing, and we need to understand that. And just brushing it away as sort of a psychological phenomenon. It has psychological elements, yes, but making it sound like it was just purely, you're just like totally stressed out, you need to get that calmed down, and maybe that's where your pain is coming from. And so that kind of gives the wrong message, okay? Because then people feel like they're being dismissed or their concerns are not being taken seriously. So what I want to do is to help educate, to tell people a little more about how we feel pain so that you understand where some of these treatments may be coming from. And really the most important thing is to understand the role of the brain in feeling pain. Okay? Remember, pain is a sense, just like your vision, your hearing. Okay? It is your ears that hear, it is your eyes that see, but it is your brain that tells you what you are hearing, what you are seeing, and evaluating that and understanding that. So your brain is this big old computer processing center over here that we have, and it does the same thing for pain. Pain is a perception. So you can feel it in your ankle, you can feel it in your knee, elbow, wherever. But ultimately, it's going to the brain, and your brain is the one that's interpreting what's going on with the pain. And usually, like I said, pain is usually a signal to the brain that something is wrong. Signals picked up by special pain sensing nerves go to the brain and say, ouch, that hurts, something's going on. So, what I want to do now is jump into a little bit of biology here. Okay, I'll keep it really simple. I use this with the teenagers I see, they will understand it, so it's not hard. Pain messages are carried by special nerves in the body, just like an electrical signal, to the brain, all right, that is going to process the signal. And this is my very highly oversimplified, hand-drawn picture of the brain. And as you can see, there are those arrows that go up, okay? So the pain can start from any part of your body. We have nerves in all the different parts of our body. They pick up a signal that something is happening, all right? The spinal cord is sort of your relay center. That's when the messages go up and they land in your brain. Of course, this happens like super, super fast. So really quick signal. It goes to your brain to what, just to keep it simple, I'm going to call it the pain center. Now, it's actually not one single center, but what it does is it goes to the parts of your brain that are going to interpret the pain experience. Now, the interesting thing about when it lands in the brain, and even on its way up, is that there are other areas of the brain that process your thoughts and your feelings that overlap directly with the pain processing centers. So they are very close together. And there are times when you can actually have activity going on in your emotional and your centers processing your thoughts that can actually, the way I call it is sort of open up your pain gate or close your pain gate, because they can send signals downward to sort of turn the dial down on pain, or they can turn the dial up on pain. So just to give you a really easy example, I tell the teens that I see in our groups, I say, let's say you went to school one day, you had a headache, and your best friend said something nasty to you. You realized you left your homework at home. You got yelled at by your teacher, and it was just all in all a day that was just, not very fun at all, very frustrating. Okay, you had the headache, all right. Now, how does your headache feel at the end of that day? It's probably throbbing, it probably hurts, and you are just miserable by the time you go home. That is the suffering component of pain. You are really suffering because you just had a bad day and you had pain to begin with, right? Okay, let's take a different scenario. Let's say you have a headache one day, but you know what? That is the day your friends are coming over for a sleepover, you guys have plans to watch your favorite television show, you're going to order pizza, your parents are going to be somewhere else, and you're going to have a great time, the girls are coming over, and you're going to do this. You still have a headache. But all of this is happening. How do you rate your pain and suffering that day? It's like you still have the same headache, but it feels a little bit different. It doesn't feel as bad. You don't suffer quite as much because your brain is in a place where you are actually literally turning the dial down on your pain, and that is a physical response. It is not something you made up. It is something that actually physically happens in the brain. And with some of the neuroimaging work we're doing now, we're actually showing that. We put people in the scanner and we sort of create a pain experience, sort of experimentally, and then we have people do different things. The brain responds differently. So pain is a complex experience, and it's affected by our memories. Have you had pain experiences like this before? Have you had other, maybe traumatic experiences with pain? Or have you had pain where pain was well managed and you were supported and cared for? And your thoughts and feelings are all involved in how this pain is interpreted. It's also affected by our lifestyle. So today, you're hearing about sleep, you're hearing about different types of exercise and movement, and also about nutritional ways to keep your body healthy. It is true that pain has a genetic component. So as you say, it sort of runs in families at times that, some people are just more pain sensitive than others. So there's definitely a genetic component to pain. But there is also a lot of other things that we do have control over that can sensitize the body to pain. So a lot of the experiential workshops that you are going to go to today are actually ways to help desensitize or reduce the sensitivity to pain. And pain does affect people differently, and some people are more reactive to pain than others. That is just the individual differences that we have. So, just to summarize really quickly, our biological factors, psychological, social, and lifestyle factors are all things that are going to influence the pain experience. And the biologic factors are like, what is the underlying disease? What is your genetic pain sensitivity? What is going on with your neurobiology, endocrine systems? And psychological factors, the mood you're in, the stress and the anxiety you feel, if there has been a history of trauma in your life that makes you more hypersensitive, hypervigilant to pain experiences, your family environment, support around you, sleep, are you sleeping well, your physical activity levels. So all of these have an impact on pain. So treatment of pain is not a magic pill. I take this medicine, my pain is gone, I'm cured. Wonderful, Because like I said, actually, pain does have a role to play. So you may want your chronic pain to disappear, but you don't want all pain to disappear. So how do we manage and control pain? So nothing against pain medicine, okay? It has its uses, but in the long term, and if it is used inappropriately, and if that is the only thing, it makes you a very passive person because you just put a pill in your mouth and then just expect wonderful things to happen. Well, that doesn't actually fix the pain because the minute you stop taking that, your pain is going to come right back. And so what are you going to do to get your life back? So a lot of research has gone on that using a multimodal approach is really the best and most effective way to get pain under control. That involves different ways, and there are so many different options available these days, it is amazing. that there are different types of physical exercises, whatever suits you, whatever suits your body type, whatever suits your cultural background. There are different ways to do exercise-based therapies. There are different types of psychological therapies or meditation-based therapies and things that you can do that actually help control and manage the pain. And the way they work is really turning the dial down on pain and then keeping that pain gate sort of closed in your body. And really, there's more and more, and there have been a lot of surveys done. People are seeking out more mind and body treatments for pain in addition to usual medical care. So these are complementary. They're not necessarily alternative. You don't just say, okay, I'm just going to ditch everything and I'm going to do just this one other type of treatment because I'm tired of taking medicine and I'm not going to do that. Okay, well that may happen, but there are times when you do need a little bit of medicine to keep things going, keep the disease under control, but then you can do some of these things that you do have in control that you can learn. And we are seeing a lot of increasing evidence, and Sean Cotton and others, people are really starting to do more research, and really the way you get insurance doesn't cover oftentimes these treatments, but the more and more the evidence builds for these types of treatments, you can definitely start seeing a transition over that people are starting to now cover for things like acupuncture. People are covering something that I do personally called cognitive behavioral therapy that I'll talk about in a minute, is something that used to be a complementary treatment because it was psychological. And guess what? Insurance companies are, for the most part now, paying for cognitive behavioral therapy because it's become part of standard medical care in many of our clinics. And so things they go from complementary to regular medicine, and they just kind of get incorporated. So we've seen that happen, which I think is enormously encouraging. And so this whole idea of integrative medicine approaches for chronic pain management is becoming more of a thing that people are understanding can be actually very effective. And also a recognition of the downsides to long-term use of only medications for chronic pain. They have side effects. They almost all have side effects. There's dependence, and as you can see in the news, when it's used inappropriately, it can lead to overdose and opioid dependence, or at some point times even death. Some medicines may lose effectiveness over time. Many opioid medications are like that, and they can have this effect, which they've shown in research labs, that they work for a while, but then you increasingly need either more medications or they actually sensitize your body more to pain. They have like this backwards effect over time. So you got to be really careful with those. And then to have a better sense of control over your own life and your self-confidence in managing pain, it is really useful to have these sorts of integrated things that you can do by yourself. And it really gives people a good sense of self-efficacy, which again helps with pain control. All right, so how do mind-body therapies work? The majority of them work on ways to influence the brain and help close the pain gate. So by teaching the brain, I call them brain tricks. So you teach the brain ways to reduce the pain signal by using other areas of the brain. Okay, so when you're doing things like guided imagery, when you're doing things like mindfulness meditation, when you're doing things like biofeedback or using distraction techniques, those are all ways that you're doing to trick your brain into learning how to turn the volume down on pain. And we know that these tools have actual effects on the brain and the body, and that reduces how much pain people feel. The thing about it is that they do require some time and some practice, which a lot of times we don't have time. We're running from one thing to the other. We just want the pain to go away, and we really don't have time to deal with it. Pain doesn't respond very well to that sort of thing. So you really have to pay attention to the fact that your body is telling you something. You need to slow down and you need to pay attention. What is happening with your body? You need to spend the time to learn some of these practices. Most of these practices, you will require at least 6 to 8 sessions. So just be prepared for that. You're not going to go in and say, whew, pain is gone. I just went for one session. Miraculous. If you do that and that happens, great, but unlikely. You will have to work for it a little bit. But you know what? Most of these things, once you start practicing, it's like practicing a piano, learning a new skill, learning how to play tennis. You're not good when you start at it. You're going to make mistakes. Your mind is going to wander all over the place. You're going to get distracted by other things and whatnot. But as you practice it, it just gets better. Training and practice, training and practice. Cognitive behavioral therapy, and you may hear of this, and I'll just tell you what it is. It is actually a very well-studied approach for pain management. It usually takes about 6 to 8 sessions. It is not a cure for pain, but it really depends on your ability to learn the techniques well and practice them. And there's a number of different techniques that are involved with cognitive behavioral therapy, including the deep muscle relaxation, breathing relaxation, using guided imagery, learning how to pace activities, which is really an important lifestyle skill, learning how to pace yourself, learning distraction techniques, and how to deal with negative emotions related to pain. So yeah, there is a psychological component, but learning to use your brain to help with that. And we deal at Children's Hospital, we work with teens and with young adults sometimes, and we train the caregivers too in ways to help their child deal with pain. And that involves being a good coach, noticing when your child is practicing those techniques, learning when they're coping adaptively, and making sure that the family routine and the lifestyle doesn't get totally derailed by the chronic pain, which can be very distressing for a lot of families. So simple example, deep breathing. You all have done this. So I'm going to take a deep breath now because I've been talking. So what I slowly want to do is just breathe in slowly through the nose, hold it for 2 seconds.